Here today in University Rosedale at the Snowden Pharmacy. Thank you for having us. It's really a pleasure to be joining you today as well on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. We are so privileged to share these sacred spaces with our First Nations, and always reminding ourselves that we share these lands in building together and healing together. My name is Yara Sachs, and I'm the MP for York Centre, as well as Canada's Minister of Mental Health and Addictions and Associate Minister of Health. Mon nom est Yara Sachs et je suis députée du York Centre, ainsi que ministre de la Santé mentale et des dépendances et ministre associé de la Santé du Canada. It's my pleasure to be here at Snowden Guardian Pharmacy, which is truly a Toronto landmark. And welcome to the pharmacists and the healthcare professionals who are also joining us here today. For those who are here and working in our community, you understand better than most how the cost of prescription drugs has been a challenge and a barrier for too many Canadians. People shouldn't have to choose between paying for their medication and putting food on the table. Unfortunately, many are still forced to make this impossible decision. That's why in February, the Government of Canada announced the first phase of National Universal Pharmacare in Canada. This first phase is historic, and it's a milestone that will mean free coverage for contraception and diabetes medications across the country. Today, we're here to talk more about free contraceptive drugs and what this will mean for women across Canada. This will mean that 9 million women and gender-diverse Canadians will get access to the contraception and reproductive autonomy they deserve. That's nearly a quarter of Canada's total population. Cela signifie que 9 millions de femmes et personnes de diverses identités de genre auront accès à la contraception et à l'autonomie en matière de reproduction qu'ils méritent. Ceci représente près d'un quart de la population totale du Canada. Having access to safe and reliable birth control is essential. I say that as a woman, and I also say that as a mom. Reducing the risk of unintended pregnancies allows the freedom to plan your family and pursue your long-term goals, whether it's continuing your education, advancing your career, or simply waiting until an individual is ready to start a family. It's about choice. As Associate Minister of Health, I believe so passionately that National Universal Pharmacare will change the lives of Canadians and the lives of so many Canadian women for the better. I'm joined here today by wonderful colleagues, and I'm pleased to introduce at this time Dr. Amanda Black and Dr. Diane Francoeur from the Society of Obstetricians and Gynecology of Canada to share their thoughts on today's announcement. Please.
Thanks, Sarah.
Thank you.
Good afternoon, everyone. My name is Dr. Amanda Black, and I'm a practicing OBGYN. I'm also the president of the Society of Obstetricians and Gynecologists in Canada. And my colleague, Dr. Diane Francoeur, is also a practicing OBGYN, and she's the CEO of the SOGC. And I'd like to start by thanking the Deputy Prime Minister and Finance Minister, the Honourable Chrystia Freeland, as well as the Minister of Mental Health and Addictions and Associate Minister of Health, the Honourable Yara Sachs, for the invitation to participate in today's event. The SOGC was thrilled to take part in the announcement in late February with Minister Holland and Minister Ayan celebrating the new National Pharmacare Framework deal that was reached between the government and the NDP. On behalf of our members and healthcare providers across Canada, I would like to thank both Prime Minister Trudeau and the NDP leader, Mr. Jagmeet Singh, for all their hard work on achieving this deal. It cannot be overstated what an important step this is for women in Canada and the intergenerational impact that it has. Access to contraception is not only a reproductive right, but also a fundamental aspect of public health and equity. As the national voice for women in Canada, the SOGC has been advocating for coverage for a full range of contraceptive options, so the pill, the patch, the ring, IUDs, injections, and implants. Because just think, women spend approximately 35 years of their lives in their childbearing years, meaning that on average, they spend about 30 years of their lives trying to avoid pregnancy. and shouldering the burden of costs associated with that. So remember, by directly impacting 50% of the population, women's health care is health care, and it's a nonpartisan issue, which is why when it comes to women's health care and rights, we cannot afford to go back. This past International Women's Day, the SOGC issued a press release reaffirming our support for the National Pharmacare Framework legislation, Bill C-64, and urging all parliamentarians to work together to ensure speedy passage of this legislation because it is urgently needed. In my daily clinical work, my patients have told me how happy they are about the prospect of choosing a method that's right for them without worrying if they can afford it or not. Because right now, some of them have to choose between paying the rent, paying for food, or their contraception. And when making a choice about what options are best for your health or that of your daughter, sister, mother, and any loved one, the cost of contraception should never be a factor in decision-making. And many people think that contraception is already covered for everyone. What many do not realize is that currently in Canada, we have a patchwork approach to coverage, and that it often depends on a variety of factors, such as your age, your income, or where you live. They don't realize that too many women slip through the cracks, that there are simply too many obstacles for them to overcome to obtain contraception, and so they just give up. And sometimes this results in an unintended pregnancy, and I see this every day in my practice. In the last few weeks, patients and colleagues have asked me, when will this become available? Because it is never soon enough for someone in difficult financial circumstances. To ensure that the government branches can begin working on the mechanics of this, we hope that the information of full costing will be indicated as soon as possible to ensure some women can get some sense of timing to help them plan. And when considering the cost of this policy, we also need to consider the cost of non-action and the economic impact directly felt by women and their families. The direct cost of unintended pregnancy in Canada is estimated to be at least $320 million, and that doesn't factor in the downstream cost to the individual, their community, or society. British Columbia led the country in bringing forward free access to contraception, and their cost modeling showed that cost neutrality would be achieved by year 2, with a cost savings of $27 million per year by year 4. That means for every dollar invested in contraception, there's a cost savings of $5 per BC resident. This policy will ensure that women are empowered with the tools to better control their futures, including family planning, educational pursuits, and workplace entry and re-entry. It will allow new Canadians to dream about having a career and be part of a society where men and women are equal. In closing, I really can't think of a more compelling case for a need for this policy than when we see how women's rights and access to health care are being threatened and rolled back in other parts of the world. This policy is not only impacting directly here in Canada, but it also sends a beacon of light to the rest of the world to show that in Canada, we take women's health seriously. We applaud the work of the government, and we look forward to continuing to work together. As the national voice of women's health, the SOGC believes access to contraception and the ability to have a reproductive life plan should not depend on financial circumstances or where you live.
Bonjour à tous, quelques mots en français. Aujourd'hui, c'est une très belle journée pour toutes les femmes canadiennes. C'est une journée où, enfin, nous avons 2 ministres très influents, surtout lorsqu'on parle des finances, qui nous confirment qu'un jour, ce rêve va arriver et que les femmes arrêteront de devoir toujours fouiller dans leur sac à main pour couvrir la contraception parce qu'on sait que maintenant, le fardeau est sur elles. Alors, nous sommes très heureux. Merci beaucoup, Madame Freeland, d'être ici et de nous avoir invités. C'est une très belle journée pour la Société des obstétriciens gynécologues du Canada et pour toutes les femmes du Canada. Merci.
Merci, Diane, and thank you, Amanda, for those really amazing words. To know that women will be empowered in this way is really something that's so important to all of us, both in government and across Canada. Now, for the moment we've been waiting for, here to say more about the proposed pharmacare legislation is my colleague, the Honourable Chrystia Freeland, Canada's Deputy Prime Minister and Minister of Finance, to share the news. Thank you.
Okay, well, thank you very much, Yara. Merci, Diane. And thank you very much, Amanda. That was a very, very compelling case you made, a really moving case you made. And maybe you have to be a woman, a mother, and a doctor to really understand and convey how essential this measure is. So I am really happy to be here today, and I am especially happy to be here with two strong Canadian women, strong Canadian doctors who understand firsthand from their practices how important this is. So, hi. And welcome to University Rosedale. You are here in my home riding, which I have such a privilege to represent. I'd like to start by acknowledging that we're gathered on the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. As I said, I'm really, really glad to be here with my colleague, Minister Yara Sachs. I want to thank the amazing people of Snowden Pharmacy. Thank you for hosting us. You really are a community institution. And as I said, I am especially privileged to be here with Dr. Diane Francoeur and Dr. Amanda Black of the Society of Obstetricians and Gynecologists. These are the experts, and it was really important for me for their voices to be showcased. I'd like to thank everyone who's here, all the healthcare professionals across Canada, for the important work you do. You are the champions of women's freedom of choice over our bodies and our lives. That is so essential. Our government recognizes that, and we are here to support you in your work and to support every single woman, every single girl across Canada. La promesse du Canada a toujours été d'avoir une chance équitable, d'avoir une bonne vie dans la classe moyenne, de réussir aussi bien que nos parents, ou même mieux que. Today, many younger Canadians feel as though the deck is stacked against them. They can get a good job, they can work hard, but too often that reward of a good, secure, middle-class life remains out of reach. What many parents and grandparents have achieved for themselves, a degree of comfort and security, the ability to start and raise and provide for a family. That's what we want for our kids, for our grandchildren. We want their hard work to be rewarded, as it was for us. We want our children to face the future with a sense of anticipation and possibility, rather than with a sense of angst. We've arrived at a pivotal moment for millennials and Gen Z. These young Canadians have so much talent and so much potential. They need to see and feel that our country can still work for them, that the promise of Canada can still be reached. C'est pourquoi nous prenons des mesures dès maintenant pour construire un Canada qui fonctionne pour les jeunes Canadiens. Un Canada où ils peuvent progresser et où leur travail acharné porte des fruits. First, we are going to turbocharge the construction of new homes across the country, including in this riding. Second, we're going to help make life cost less. Et troisièmement, nous allons faire croître l'économie d'une manière qui profite à tous. I am so glad to be here today to announce a next step in this plan that is going to help make life cost less for young Canadians, especially for young women. In the upcoming federal budget, we will be delivering free contraceptives through our national pharmacare plan. Notre gouvernement étant fièrement féministe, nous accordons une grande importance à la liberté de choix. Cette liberté ne doit pas avoir de prix. We are a proudly feminist government, and I am proud to be a feminist finance minister. We're a government that believes women should have the right to make their own choices about their health and their bodies. We're not sure that everyone running in the next election believes that. As women's reproductive rights are challenged in other parts of the world, including just south of the border, it is more important than ever for us to ensure that Canadian women have access to contraception today, tomorrow, and the day after that. This is every woman's fundamental right. It's a fundamental human right for women. Not being able to control your body means you don't control your life, and that's not okay. Contraception can be expensive. If you don't have insurance coverage, like many younger Canadians, birth control pills can cost up to $300 a year. An IUD can cost up to $500. That's not cheap. Our plan to make common contraceptives free, including birth control pills, IUDs, and the morning after pill, will mean that for 9 million Canadian women, freedom of choice will truly be free. It will mean they don't have to pay for the fundamental right of controlling their own bodies. It means more Canadian women will have freedom of choice over their bodies and over their lives. Free contraception is just the first phase in our plan to deliver a national, universal pharmacare system for Canadians in partnership with provinces and territories. The first phase of our plan will also help make a range of diabetes medicines, like insulin, more affordable and accessible for Canadians of every generation. Le régime d'assurance médicaments universel vise à renforcer le filet de sécurité sociale du Canada et à faire en sorte que la vie coûte moins cher, et ce, pour toutes les générations. J'en dirai plus là-dessus quand je déposerai notre budget de 2024 le 16 avril. Our government first came to office with a vow to strengthen and expand the middle class. We delivered on that pledge by reducing poverty, especially for children and seniors, and creating millions of good jobs for Canadians. Our work isn't over. Our renewed focus today is unlocking the door to the middle class for millions of younger Canadians, for millions of young Canadian women. We'll build more housing and help make life cost less. We will drive our economy towards growth that lifts everyone up. And in everything we do, we dedicate ourselves to keeping the promise of Canada within reach for our younger generations. Because that's what you've earned. That is what you deserve. And that is what your parents and grandparents want for you, too. Thank you very much. I'm happy to answer your questions.
Bon après-midi, merci d'être venu. On va maintenant prendre les questions des médias. We'll now take questions from the media over at the microphone here. I just ask that you state your name and your media outlet before asking your question. We'll take one question and one follow-up per outlet.
And there are other people here too. I think they'd be happy to answer questions as well.
Okay. Hi, I'm Michelle. I'm with City News. Thanks for being here.
Hi, Michelle.
So to begin, there's this number, 9 million Canadian women. Why just 9 million? Where's that coming from?
That's an estimate. That is who we think will find themselves benefiting from this program.
Okay. And then you mentioned...
I'm sorry.
Sorry.
It's hard not to look at the person you're talking to.
No.
Sorry about that.
Okay, did you want me to re-ask that?
No, just
Nope,
go ahead,
we're
carry
good?
on.
Okay.
Just the next one.
Next, just to follow up, you mentioned making diabetes medication more affordable. How much more affordable?
Again, details of the plan are going to be rolled out. And I do want to emphasize, we're going to go step by step. We've decided to start with contraceptives and diabetes medicine because we think those are great places to support women, support young women, support them to have real control over their lives and their bodies. And because we know that diabetes is a condition that really afflicts a lot of Canadians and is really making life, paying for insulin is making life less affordable. So that's where we've started. You're going to see more details as the plan rolls out. And as I said, as Yara said, we're committed to going step by step, providing more and more coverage every day, as you've seen us do with dental care.
Thank you so much.
Good afternoon, Ethel Musa with CBC. Ms. Freeland, when can Canadians actually be able to benefit from this program? What's the timeline around that?
So as you've seen with dental care, this is something that we are committed to. It's something you're going to see us roll out in a step-by-step way. It's a big deal. It's a big extension of Canada's social safety net, and we are very, very glad to be doing this. I think everyone recognizes that this is going to require cooperation, collaboration with the provinces and territories, and that is something that we are I was going to say roll up our sleeves. I'm not wearing sleeves, but metaphorically, we're rolling up our sleeves and we're going to get this done. We are committed to doing it. We think it's really important. It addresses important needs for Canadians. It meets people's healthcare needs. It is a feminist policy. And at a time when the cost of living is a real challenge for Canadians, this is an important way of easing the pressure for a lot of people. So we're committed to getting it done. We're going to have to work with our partners, but we believe that this is something Canadians want and need. And so our hope and our belief is partners are going to come to the table.
Would you be able to answer that in French as well, please?
Merci pour la question. On comprend l'importance des médicaments dans les vies quotidiennes des Canadiens et Canadiennes. Aujourd'hui, on veut souligner l'importance pour les femmes, les jeunes femmes et les filles de la contrôle sur nos corps. Et pour cette raison, c'est très important que chaque femme ait un accès abordable aux contraceptifs. Nous comprenons que ce sera essentiel de travailler en étroite collaboration avec les provinces, avec les territoires, pour livrer ce programme si important. Mais on est absolument confiante que tous les Canadiens et Canadiennes comprendront l'importance de cette initiative et qu'on aura une étroite collaboration. Merci.
Ms. Freeland, as you mentioned, the federal government will be working with provinces and territories to strengthen spending on public drug programs. Are you going to be working with the provinces and territories individually? And if you could please also answer that in English and French.
Thanks for the question. We recognize that healthcare is a provincial responsibility. It is the provinces who deliver healthcare. We respect that, and we know we're going to have to work with provinces and territories to provide this additional support. We are absolutely committed to doing that, and I think that we are going to find real enthusiasm, real willing partners across the country, because I think this is something that Canadians know is the right thing to do, that Canadians know they need. And I really want to underscore the importance of reproductive health, of contraceptives for women and girls. It is essential. Controlling your own body is an essential human right. And for women, that means being able to have birth control. We've just heard from the people who work with women and girls every day that it's still too hard for too many Canadian women and girls to get access to birth control. And that means they don't control their own bodies. And I think we really just need to take a minute and say, that is not okay. And I am so glad that our country is now taking this essential step to treat women as full human beings who deserve to have full control over their bodies. And that is why I am so hopeful that we are going to be able to quickly and effectively collaborate with provinces and territories to deliver this. Alors, je veux souligner l'importance pour les femmes, les jeunes femmes, les filles de cette mesure-là. Si tu ne contrôles pas ton corps, tu ne contrôles pas ta vie. Ce n'est pas acceptable. Et c'est pour cette raison que cette mesure est si importante et que je suis confiante qu'on trouvera des façons de collaborer avec les provinces et territoires pour livrer cette mesure qui va vraiment améliorer les vies de 9 millions de Canadiennes, des femmes, des filles. Merci.
Hi, I'm Maria Saru with CHCH. You're stressing your hopefulness and confidence about collaborating with provinces and territories. We're in Ontario, where the Progressive government has pushed back against expanding access to free contraceptives. So how exactly will you incentivize provinces and territories to cooperate? What's your plan?
Again, thank you for the question. And I really believe that at the end of the day, every single person who is elected in Canada, the governments of provinces and territories, the governments of the federal government, at the end of the day, we are working for the same people, for Canadians. And at the end of the day, I really think we want the same things. We want Canadians to have a good life, to be able to afford a good life. We want Canadians to enjoy their full human rights. And for women, free contraceptives are about making life more affordable. They're about putting women in charge of their bodies and their lives. That's really basic. It's really simple. And I am confident that building on that basic truth, we will be able to find a path to work together with provinces and territories. And, you know, I'm thinking back, as we have been putting together this measure, I've been thinking back to early learning and childcare. And there were a lot of skeptics at the beginning when we announced that program, a lot of people who said, how will you convince the provinces and territories to come on board? In the end, we did. And the reason for that is because Canadians said, this is a great idea. Actually, this is something we want for ourselves, for our children. I believe that making contraceptives accessible to all Canadians is a measure just like that. So that's why I'm confident and hopeful.
Okay, thanks for that answer. Last month, Minister Mark Collins said the cost of this plan, which was at the time expected to be around 1.5 billion, would not be in this year's budget. So what has changed?
So I am not going to go into details today of costing and of the fiscal framework. I am here today, though, to emphasize that this is something we're committed to. It's something that we are going to do. It's something that is going to happen because it's high time that we support Canadian women and girls with this affordability issue and also, frankly, really give them full control over their lives and their bodies.
Thank you.
Hi, Tessa from a CBC Parliamentary Bureau. So the Manitoba government has confirmed it is developing its own carbon tax plan and is intending to ask Ottawa to remove the federal backstop from the province. What is your reaction to the news? And if we can get it in English and French, that would be great.
The Prime Minister has been really clear that we believe that where provinces and territories are interested in and are prepared to come forward with their own provincial or territorial plans to put a price on pollution, we are very, very keen to work with them. That has been the case. That is the case today with British Columbia and with Quebec. They have provincial systems that work really, really well. And as the Prime Minister has said publicly, as he has said in a letter, if any provinces and territories want to come forward with a good plan to work with us to be sure that their plan is robust and meets the marks, then I think that's really good news. Comme le Premier Ministre a déjà dit, comme il a dit publiquement, comme il a dit dans son lettre au Premier ministre des provinces et territoires, on accueille toutes les initiatives du côté des provinces et territoires pour créer des plans provinciaux environnementaux pour mettre un prix sur la pollution. Le Québec et la Colombie-Britannique ont ses propres plans provinciaux, ces plans fonctionnent et on sera très très contente de faire du travail acharné avec toutes les provinces qui veulent proposer un plan provincial. Évidemment, ce sera essentiel que le plan est adéquat, mais on sera très très content de travailler avec toutes les provinces, y compris le Manitoba.
Thanks very much, everyone. That concludes today's press conference.
Yeah, and thank you. I want to say a special thank you to everyone who is here for coming out on a long weekend, to the healthcare professionals who are here, to all the journalists who are here. Thanks a lot. I really appreciate your hard work.